A government scheme aimed at turning around the lives of the most troubled families in England is said to have produced life-changing results. Louise Casey, who's running the programme, says in her latest report that early intervention has reduced crime among the families involved by 45%, and antisocial behaviour is said to have gone down by 59%. Our political correspondent Gary O'Donoghue has more details.
David Cameron has promised to use £500 million of central government money to help the 120,000 most problematic families in England. Currently, around a third of this group has been identified by local authorities for enrolment in the scheme, which sees them assigned a caseworker and supervised closely in all areas of life. Ministers believe that these families not only cause misery to the communities where they live, but also cost the state around £9 billion a year through the criminal justice system and other services. The head of the Troubled Families Programme, Louise Casey, said the approach had produced a dramatic impact, not just on the families themselves, but on the communities in which they live.
That's Gary O'Donoghue. Well, Wendy Weal is Managing Director of Interface, which trains people working with vulnerable families.
The government has put out a statement as to what they think troubled families are, and that is families that are out of work, families where their children aren't attending school 85% or more, or families where there's antisocial behaviour or crime involved.
So the government is saying that family intervention is the most effective way to turn things around for these families. What do they mean by that?
What they're talking about is building on the success of family intervention projects and intensive intervention projects that were set up actually under the previous administration. There's quite a lot of evidence to demonstrate that they're effective, certainly in reducing antisocial behaviour and crime and in terms of getting children back into school.
Do you agree with that assessment?
I set up a family intervention project several years ago, and then I worked for the previous administration setting them up all around the country. So we had a team that set up 371 of them, and they were highly effective. So yes, I would argue that doing something in a whole family way is the right way to work with these families.
Are there any problems that you see in the system?
I think the problems that there are at the moment is, apart from the fact that there's massive budget cuts, so I suppose the first thing to say is that we had a really successful range of programmes throughout the country, a lot of which were then cut after the administration. We wrote business cases and many were supported, but several have been cut. And of course then people go back to the drawing board to think about who are the families that they need to be working with. So the issue now is that the new Troubled Families agenda focuses on those families. When you speak with a local authority and their partners and ask them who are the families that cause you most concern and most cost, they're likely to say that they're families with substance misuse, domestic abuse, mental health issues, children on the edge of care. They're the very high-cost, worrying families, which don't necessarily fit the three criteria that the government are asking them to target. So the job in hand for local authorities now is to try and make the best use of the payment by results opportunity that the Troubled Families Unit are prepared to pay for areas, but at the same time make sure that they indeed do get the families that they believe are the right families for them, and they will be the families that I've just mentioned in terms of high cost and known to several agencies with families with multiple and complex issues.
Do you think then some families that need help are actually missing out on it?
I think potentially for a period of time, yes, they may well be. And that's because local authorities at the moment are still struggling to identify who the right families are across a range of agencies. So when they hit a threshold, for example, in terms of children's social care intervention, they will get some support there. And if they're already in a family intervention project or they're already working with a youth offending team, they will get some form of intervention. What they won't necessarily get, unless they're in a family intervention project already, is a whole family intensive support package. And the difference is that, you can work with one member of a family, say when a child offends, but unless you're also working with mum who may have a mental health issue or not be getting the children to school for other reasons, potentially substance misuse, unless you tackle all of those, you can have a very effective single intervention working with that one person in the family. But unless you work with the whole family, you won't change them systematically. You won't change the long-term outcomes for that family unless you work with the whole family.
That's Wendy Weal speaking to me earlier.